kwanza I think imeingia. Why don't we have footage? Bring footage. Haya, let's talk about sickle cell anemia. Okay, first of all, if I focus there, just know we are on YouTube. Okay, so main focus in pale. Okay, our main camera. All right, good morning class, how are you doing? So tomorrow, for the updates, tomorrow we'll be talking about D dimers. Okay, what is D dimer and how does it affect tomorrow we talk about D dimer, what is it, how it is tested and what it does. So class ya kesho tuta agree, kesho we are talking about D dimer. Today we want to talk about sickle cell. Yes, and I want to see people on my YouTube page. If you are here, please kimbia huko YouTube, class ndo inaanza. So our first order of business is to talk about, yesterday we talked about polycythemia. Polycythemia is where you have too much of red cells. Too much of red cells is poisonous. You need to tap the screen here. Yes, and also people for my YouTube, okay? So yesterday we talked about polycythemia. Polycythemia is too much red cells. Dangers of polycythemia is clots. Okay, thick blood brings about clots. Clots bring about stroke. They bring about heart failure. Right. So today we want to talk about something called sickle cell. Right, sickle cell, and we link that to anemia. Okay, anemia. Very nice. So what is anemia? Remember we said polycythemia is increased red cells, okay, and is marked with high levels of HB. Very nice. So anemia is anything low. We said normal blood should be between 12 to 16 for women and 12 to 18 for men. All right. So we said anything above 16 and 18 is polycythemia, right? And anything below that is anemia, right? Low blood level is anemia. Are we together? Low blood level is anemia. And we want to focus on something called sickle cell anemia, okay? Right? Sickle cell anemia. So the fact that it's a sickle is something that looks like this, okay? Sickle is something that looks like this. A sickle, hila kitu tuna, the thing that we used to cut thar. You know cutting thar? Anyone who knows how to cut thar is grass. It is used to cut grass, okay? Very nice. So that is a sickle. So if a cells look like this, a normal cell should be not oval, not circular. They are in between, okay? Why is that important? It's able to move in through the veins. Very nice. It's also able to carry more hemoglobin. More hemoglobin means more oxygen. More oxygen means more oxygen molecules to your cells. More oxygen to the cells, more energy, okay? So that's something that you have to put in mind. So in sickle cell, you inherit it, okay? There's someone who has sickle cell trait. Sickle cell trait means, no, let's first start with sickle cell. It's genetics, okay? You inherit that from your parent, okay? So if you inherit two sickle cell, if you inherit one S from your mother and another S from your father, now you are a full sickler, okay? But if you inherit one S from your parent and the other one gives you A, I have jumped so much. I've rookered this thing very fast, okay? Let's talk about the hemoglobin. So remember that hemoglobin are of many types. A normal person has hemoglobin A, okay? So when you have hemoglobin S, that is when we say you are suffering from what? Sickle cell, right? You have your genetics, your hemoglobin, you have hemoglobin S, okay? So hemoglobin S, if you inherit hemoglobin S from one father and another from your mother, if you have two, now you are a full sickler. You're suffering from sickle cell disease, okay? But if you inherit one from your parent, let's say you're SA, so you have a sickle cell and a normal hemoglobin, so you're having something called sickle cell trait. So you have inherited an S and an S, so you have sickle cell disease. So the fact that you have sickle cell disease, you have red blood cells that looks like a sickle. I don't know if you can be able to see right here. I don't know if you'll be able to see. It can't focus. It cannot focus. Very nice. So a sickle is something that looks like this. A sickle looks like this, okay? A sickle, this is a cell. A normal cell looks like this. So you see, even from your normal eyes, you can see like this one, there is something we call increased volume to carry hemoglobin compared to this. If you look at this one cannot carry enough hemoglobin. Now this carries a lot of hemoglobin. This is a normal cell. Very nice. So, what is sickle cell anemia? There's something called RES. RES is reticuloendothelial system. Reticuloendothelial system works in like the way the dome of Israel works. It is able to recognize sickle cells. Okay? Your body is able to recognize sickle cells. And I'm like, wait a minute. Why are you looking like a sickle? Why don't you have enough hemoglobin? We should be destroying you. We should really be destroying you. What the hell? So, the destruction of sickle cells causes low blood level. Low blood level is anemia. But what are the some of characteristic of sickle cell? Number one, sickle cell, they have a bad shape. They have a sickle shape. That's a problem. Why? Because they are very sticky. If they are very sticky, they cause a problem with blood flow. Right? They cause problem with blood flow. The fact that they are sickle, they carry less hemoglobin. Less hemoglobin equals less oxygen. Less oxygen means problem with the cells because oxygen cannot reach cells. Very nice. So they are very sticky. They are very sticky. They have less hemoglobin. That means they don't carry enough oxygen. Very nice. What's the other thing to say about sickle cell? The fact that they are a sickle, they don't carry. So how can you test that you have sickle cell? There's something called HB. First of all, we need to do something called full hemogram. Why? Because full hemogram is going to tell us the level of the number of RBCs and also HB level. That's very important. So if you see your HB levels are chini, why are your HB level down? Because the RES is destroying your red blood cells. The other thing else, if you're going to have jaundice. Why are you having jaundice? Because the sickle cells are being destroyed in the liver, and we say red cell destruction leads to bilirubin levels, increase in bilirubin levels. Tuko pamoja? Increase in bilirubin levels. So if we do full hemogram, you have low HB. If we do what you call liver function test, you have high levels of bilirubin. So the other thing we need to do is called HB electrophoresis. So I know you are asking yourself, what is a HB electrophoresis? Thank you. We have people viewing on YouTube. That's very great. HB electrophoresis is able. It's like we put your blood here, and this blood, there's the magnitude of how we test hemoglobins. Okay, so hemoglobin A, hemoglobin S, hemoglobin. Do you have hemoglobin A? Hemoglobin F? I think so. So HB electrophoresis is the one way for us to determine if you are carrying the hemoglobin S. That is one way we will be able to know if you are having hemoglobin S or not. The other thing, you see, if you are having, there's a test that we are doing here on the Maskio. We tap here, we put on a slide, and then we don't expose that those RBS to oxygen. They sickle. That's also another test. I think it was called what was it called? The test was called what? It utilizes, is it bicarbonate? Something bicarbonate. I've forgotten the test, but the main test to determine if someone is suffering from sickle cell is the HB electrophoresis, because that we are able to determine we are able to determine the HBS, HBA, and such kind of stuff. Okay, people who suffer from sickle cell. So sickle cell is treatable. Do you know that sickle cell is very treatable? So how is sickle cell treatable? Where are cells manufactured? Yesterday we said that cells are manufactured in the bone marrow, right? In the bone marrow, right? Even these sickle cells are still manufactured in the bone marrow. So the best treatment for sickle cell is the fact that we can get bone marrow transplant. That's number one. That now is a full treatment. Bone marrow transplant. Let's say I have a hemoglobin A. So my bone marrow is taken and then it's given to you. When it's given to you, now you'll be able to produce good, healthy red blood cells. So number one is bone marrow transplant. But there's a condition that arises with people who suffer from sickle cell. Number one is low blood level, right? But now, low blood level, mimi najua ndafukuzwa class. So low blood level, kama hauyuko YouTube, unasema utafukuzwa class, you are making a very big mistake. So low blood level, how do we treat low blood level, right? Number one is blood transfusion. Blood transfusion. But blood transfusion is not a long-term goal. Why? Because cells have a lifespan when they're in your blood, lifespan of 120 days. Okay? When we give you blood has a lifespan of 120 days. Now 120 days is so when 120 days goes, the liver destroys the red cells, so you still have the same problem. So you see, the problem of continuing giving you blood is not sustainable. Okay, but the procedure of having bone marrow transplant nayo pia sio kidogo. No, bone marrow transplant is not easy. I think it's only done in I don't know if Kenyatta do bone marrow transplant, but many people would opt to go to India for a bone marrow transplant. Our government would have done better if wangeamua kutupatia. Especially people who are in the rec side. Hey, rec side people, that's the problem of intermarrying people. And I have a problem. I have a very serious problem with people who know that their first child is a full sickler and they continue and give birth to another child. Are you sick in the head? You two people gave birth to a full sickler. You really know that this child is a full sickler. And then you go ahead, go into your blankets and decide to give birth to another child. Are you crazy? The first child is already a full sickler. Get another man to get you pregnant. You are bringing a child who will have problems. Your first child is a full sickler. You're already suffering. You are already suffering, and then you go ahead and give birth to another child like it is normal. It's like people who have some genetic condition. Two people who have genetic condition, and then you go ahead and marry each other. Are you okay? You have genetic problems. You want to take that to your children. Me, if I have made the CS of health, Mungu moja, I'm going to put a rule that two people, especially people from the rec side, when they go for prenatal testing, they should be checked if they are suffering from sickle cell. Because if you are suffering from sickle cell and your husband is suffering from has a sickle cell trait and you have a sickle cell trait, you two people should not marry each other because you're going to give birth to a kid with problem. A full sickler. No, dwarfism, I don't think dwarfism is bad. But sickle cell, that one I will not agree. You have a problem with albinism. Two people, Jesus Christ, two people of albinism get married. I'm not against these people, but I'm like, why would two people of suffering from albinism get married? Are you okay? Are you normal? Why would you do that? Huh? some serious genetic condition, and people are out here pretending like it's normal. For prenatal testing, when I made the CS for health, people from the rec side, when they go for prenatal testing, they will do a HB electrophoresis test. And if we find you that you have a sickle cell trait, and you will bring your husband. If your husband yes, we can test the mother and the father. Okay, we can test the mother and the father. If we find out that the mother has sickle cell trait and the father has sickle cell trait, that marriage is off. Go find someone else, or you will never give birth. And if you do, we will take you to court, because you cannot give birth to a child who is going to suffer in this world. We must be logical. You are suffering from a genetic condition that is quite bad, and then you go ahead, find someone else who has the same genetic condition, get married. You must be crazy. You must be jailed. Okay? What are the dangers of sickle cell? Dangers of sickle cell is death. Yes. If you cannot afford bone marrow transplant, why the hell are you marrying a fellow sickler? You know, such things just annoy me. Okay, sickle cell is very painful. The medication for sickle cells are also expensive. And governors in these counties of ours don't realize that this is a serious problem. And then, you see, let me also question teachers. Okay, teachers, I see you telling students go running. You see, they have said there's a test that we do here that checks if your cells are sickle cells, because if we deprive your cells from oxygen, they are going to sickle. Okay, and then one problem of people with sickle cell, they do not have enough cells to transport oxygen to vital organs, and then you go ahead and tell children to go running. Atiambia watoto waende wakakimbia huko nje. You are subjecting them to low oxygen levels. You're going to kill someone, kid, and you will go to jail. Mambo ya kuambia watoto wakimbie, you should be very cautious. Okay? Something bad might happen. The cost for checking if someone has sickle cell is around HB electrophoresis is around 2,000 to 3,000 shillings. Yeah, people from the it is the reason why it is common in those areas is because people intermarry. People with sickle cell trait intermarry right, left, and center. Okay, what is the problem? People in coast, they have more oxygen. That is not usually the problem. But when they come to town, in highlands such as in Nairobi, how will running lead to the disease? Running does not lead to the disease. Running does not lead to the disease. Running does not lead to the disease. We have said running, you need oxygen. And you have said people with sickle cell, is a sickle, okay? A sickle like this. What's the problem with a sickle that looks like this? It has less oxygen, because a normal red blood cells might look like this, okay? So like this, you see there's more oxygen. Like this, there is less oxygen. So there's something called RES. RES is able to identify this sickle cell and it destroys them, okay? So another characteristic of sickle cell is that they clump together. If they clump together, they are unable to let blood flow go very well. So it also becomes very painful, right? So if you are subjecting your kid to running, so when you run, you need more energy. Where do you get more energy? You need more oxygen. Sickle cell cannot deliver that oxygen to the cells. So the kid is going to faint and the kid might die. And then you will have legal problems with the parents. Okay? Sickle cell is a hereditary kind of disease. Okay? How can you know you're going to give birth to children who have sickle cells? You go get tested. You do a HB electrophoresis. Check in your home if there is a history of sickle cell, especially people for the lakeside and the coast. So sawa, sickle cell, you inherit that from your parent. Sickle cell, you is the how you end up with sickle cell. You have said you inherit hemoglobin S. Hemoglobin S, you inherit an S from your mother and S from your father. You become a full sickler. Okay, if you have one, you will have sickle cell trait. You marry someone else with a sickle cell trait, you're gonna give birth to someone who is a full sickler. So sawa, tafadhali muwache kuoa ovyo ovyo. And if your first child has sickle cell, don't get another kid, please. Don't get another kid. Get another husband. Get another wife. Or just stay like that without getting children. Yes. That is the topic for today. Very short and precise. Yes. Very nice for people on YouTube. Hi. Hello. People are haters. And I have seen your hate. You people on TikTok, I have seen your constituted hate. And mwezi enda to stream YouTube. 41 of you. You know how that would be nice? My people on YouTube, hi. Thank you very much. Yes. So we do HB electrophoresis at our lab. Just visit our lab. We can do HB electrophoresis. We have said that HB electrophoresis is a test that determine what hemoglobin levels you have. Okay. Asante sana, lesson imeshika kushinda ile ya majani. Thank you very much. Washida. Dream girl. Max unaniambia thank you na how yuko YouTube. Talk about thalassemia. Okay, we'll talk about thalassemia tomorrow. No, the other day. Tomorrow we talk about D-dimer test. We talk about thalassemia. Okay, we talk about thalassemias. Yes, acha niende. Kimbia huko YouTube bwana. Enda uongeze views. I think there are 8 people viewing. 8 views. That's quite good. 2 people are concurrently watching on YouTube. This is information that people pay for. Yeah, you pay for now. You are not on YouTube. Wewe ni hater, Duke of Nairobi. You are a hater. Wewe ni hater. Yes, so we have said D-dimer, thalassemia. What else do you want us to talk about? The link to my YouTube is on the bio. Ama you go to YouTube. The YouTube name is called Health Matters Plus. Yeah, kama uendi YouTube Duke usijaribu kutuongelesha. Wewe ni hater. Nilikuwa niongee upusi lakini juu umeniita, wacha nikuwe na heshima. Dream girl, kimbia YouTube. Kama huyuko YouTube, you are hating. Yes, go on YouTube and say hi. No, I have not seen Rigiji today. Yes. So what do you want us to talk about tomorrow? Just comment down below. I'm going to write that down. Okay? Yes. Our YouTube name is called Health Matters Plus. I see some people have increased. What about if I have blood group O and my girlfriend has blood group O positive? Any advice? There is no advice. Esther Carbo. Hey, how are you? Thank you. Thank you for commenting on YouTube. I love you. There's no problem. If your girlfriend has blood group O negative and you have blood group O positive, make sure you go for clinic. There's no issue. We are in the 21st century. We can deal with that. Okay, unless you visit a hospital that they are lecherous and they don't inject your wife with anti-D, that one will be a problem. Yes, 3 people are on YouTube. Thank you very much. Blood O. There's no problem of having any blood group. Is if you're here on YouTube and you're not saying hi, you risk woman as yaf. Yep. Janelle. You have made me learn so much from this video. Thank you very much. I am glad. YouTube are kind people. YouTube are kind. Nyinyi hata hamwezi appreciate. My YouTube fellas are very kind. Simfanye hivi hata munipatie moral. Muende watu 10 YouTube ni waone. Ongeza TFT kwa hizo lessons. Okay. You want us to talk about TFT? TFT, that is thyroid function test. Okay. Class info. This is a master class. Thank you, John Wamboi. Thank you very much. That is my YouTube. Asimwende watu 10 YouTube, at least niwaone hapo nifurahi. Si mnifurahishe leo, si nimewasomesha. To know your blood group is how much, na hiyo sample ni lazima mtumie ile shindano. The Duke is here. Thank you, Duke. Thank you. How is the voice, Duke? How is the video quality? I want to know that. Blood group in our lab is 500. Yes, 500. Yes, blood group is 500. 500 Sherik. And also, if you are rhesus negative, for us to confirm, if we do a DU test. A DU test is going to tell us it's also 500. Yeah. Aside from STD, what test should I do with my partner? Okay, we will talk about tests to do before marriage. Test to do before marriage. Tutatafuta siku yake, but just to mention HIV. HIV is one. Hepatitis. Poki Max, nimefika huku lakini sound ya TikTok ndio iko clear vizuri. Waacha mambo yako wewe, uko sure? The sound is superb. We will definitely work on lighting. Lighting is not... Yeah, lighting is clear there, but kuja hapa I don't know why it's having a problem. So you said HIV, hepatitis. Hepatitis are a few. A, B, C, D. Hepatitis. We have... you can also do sickle cell. Why am I forgetting? HIV blood group is not important. HIV blood group, hepatitis. I'm forgetting. STD. Which else? Just thank you for liking. 10 views on YouTube. That's great. That's beautiful. Beautiful. At least we are going somewhere. Things that may influence. There's a test we will talk about. Is called it checks for genetic conditions. Okay, checks for if you're gonna give birth to a genetic genetic screening. Is there's a test. Rhesus factor, it doesn't determine marriage, if you should marry someone or not. Rhesus factor doesn't determine that. That was something we can conquer. But you see, HIV, hepatitis, those are serious stuff. I will come because blood sugar doesn't determine that. And I should ask you a question: can you marry a diabetic person? That's something you should know. Genotype, no. Genotype isn't. Which part of the hand do you get the blood sample from? Yeah, you can get blood from here. This part. Yeah, man, when I see people commenting on my live on YouTube, I feel great. My lord. Mwangisaka, no, genotype is not. I'm trying to think of something. I cannot think of something. Anyway. Basilic vein, yeah. So tomorrow we talk about thyroid function. Yeah, you can do a scan. Yeah, a scan will definitely do. Yeah, a scan will definitely do great things. Top fan. Let me see top fan on my YouTube channel. John Wamboy, Esther, and Poki. Those are my top fans today on YouTube. So, tomorrow we talk about thyroid function. Tomorrow is thyroid function and how it interferes with your life and energy. Thyroid function. Sasa siku ya D-dimer na TFT tuitafutie siku zake. D-dimer test. Niambia location, Rhesus test. We are located in Zambezi. This is my number. You should save this number, okay? Yeah, fertility test. Yes, fertility test is very important. Fertility test. Ndio, when you are getting yourself into this marriage, you know, can this person be able to give birth or not? Yes. We are located in Zambezi. My number is 0740 250 696. Yani watu 66 amwezi enda YouTube. Lakini ni wabaya. Lakini ni sawa tu. Can you tell whether one has type A or type 2? Yes. And the test is called C-peptide. C-peptide C-peptide test. I will do a video about that. Thank you. 4 people on YouTube. Wow, that's great. Oh my God. That's beautiful. How do you do male fertility test? Male fertility test, we check sperm analysis only. Yes. Male fertility test, we do sperm analysis only. That's how we do it. So for females, we do AMH. AMH is a test that checks for egg reserves. Siko pamoja? Thank you very much. Yes. Yani mmesema watu 10 hamtaingia YouTube. Just 10 of you. Just make me happy, sir. Are you living in Nairobi? Yes, I'm living in Nairobi. Nairobi. I live in Nairobi, Zambezi. But Zambezi is Kiambu. Doc, check your DM. Ingia YouTube kwanza. I go to DM and I answer people questions for free and they cannot support my YouTube live. No way. And I'll check my DM, don't worry. I'm joking. Day Walker. I've said my number is 0740 250 696. We are located in Zambezi. We do all medical laboratory tests. Okay? Yes. A question, please, and don't judge. How will you get the sperm sample? Yes, you come and masturbate. Yes. Cost of C-peptide test. Let me check how much we are charging for C-peptide test. It checks if you have diabetes type 1 or diabetes type 2. I love how we are streaming on YouTube, and I'm going to run OBS. We will be streaming every platform. C peptide. Okay. C-peptide fasting, okay? Aids in assessing endogenous insulin production in diabetic patient, helps in differentiating between diabetes type 1 and type 2. That is 4,800. Tuko pamoja? Yes. 4,800. Watu wangu wa YouTube mmesikia hiyo? 4,800 shillings. I'm very happy. YouTube is doing great. 3 days of streaming and tumegonga watu watatu. Haya. Anything else you want to learn? So tomorrow we talk about thyroid function. We talk about I think D-dimer, we should combine D-dimer and thalassemias. Yeah. And I will do a content on C-peptide and how it can help in identifying type 1 and type 2 diabetes and what the result says. Anyway, thank you very much. Our lesson is coming to an end. Yes, mimi sitakangi kukaa huku TikTok sana juu hata hamunipei gift na hata hamuendi YouTube. Yeah. So TikTok ni watu manyoks. Lakini ninawapenda sana. Anyway, si tupatane kesho. Mambo iko aje? See, things are better now. Yes. For those who are late, we talked about sickle cell. Those video will be appearing on For You page. Yeah, the use of sodium metabisulfate to test for sickle cell. Is it efficient? It is efficient, but the best test to do is HB electrophoresis. Kesho tunapatananga live kutoka saa 4 hadi saa 5. 1 hour of great uninterrupted content. Anyway, I love you very much. Have yourself a good night. People for YouTube, I love you. I love you very much. Let me understand now how we will be able to stream on YouTube and Facebook all together. Watu wa Facebook tunawakujia. We will be coming for you, my Facebook fellows. Yes, time is perfect. We're gonna be there. Don't come here on TikTok. Be on YouTube.